for inviting me. This is my disclosure, and we're going to be talking about sexual anti-aging and safe methods, how to boost energy and sexual performance in old age. Sexual dysfunction is multi-determined. It's the body image, your self-esteem and your self-confidence, health and fitness, energy, detoxification, and of course hormonal balance. As we're aging, the flame is gone, both for men and women, and you have a decreased sexual libido, low energy levels, reduced muscle mass, muscle weakness, weight gain, mood swings, and of course fatigue and hot flashes, hair loss, and the loss of the self-confidence. Now, hormonal imbalance is also shown in our skin. The cortisol is increased and testosterone is decreased. So you have wrinkles, you have pigmentations, you have eczema and rosacea, and all of these are the result of the stress of the body and the cortisol increase. Of course, the most important hormones associated with this sexual dysfunction, one of them is testosterone, which is declining with age. And insulin, sexual dysfunction among diabetics is quite pronounced, and there has been a lot of research related to that. For the men, they're trying to kind of influence sex with different, being creative, and women are just having the excuse of a headache. And thyroid has been quite also pronounced in regulating sex drive, just citing some of the many different studies that have been in the literature. Cortisol is otherwise called the aging hormone, and it has to do with hypothalamic, pituitary, adrenal axis function that will change over the course of aging. Stress-induced secretion of the hormone cortisol predisposes older adults to negative health outcomes. Psychological resilience, however, can counteract this increase of cortisol, and the problem-solving reappraisal of the psychological way of dealing with stress can actually affect cortisol increase and counterbalance it. Estrogen decline in women creates bleeding and burning sensations during intercourse. There is a loss of subcutaneous tissue in the mons pubis, atrophy of the labia majora, shortening and loss of elasticity, etc. Collagen and elastic contact decreases by 50 to 30%. And the sexual dysfunction, actually the sexual desire, is mostly with women rather than men, and you can see in the diagrams of this study that it's primarily the women that basically have a much less frequency in sexual intercourse than men as they're aging. Of course, bacterial vaginosis is a very important aspect of this, and basically leads to increased vaginal and bacterial infections. And there is many different techniques that have been cited already: hormone replacement, lasers, radiofrequency, of course the surgery, and there is some newer techniques that are based on signaling and exercise. Is like a simulated exercise and signal repair. And all of these techniques report decreased dyspareunia, that means less pain during intercourse, and decreased vaginal laxity and incontinence. The signal-simulated exercise and signal repair is also reporting enhanced sexual satisfaction. And I have some comments about the sexual satisfaction questionnaires. They need to focus on this physiological results, but also explore the psychological component and ask if women report satisfaction. And is that a result of relief? Or are the women actually trying to satisfy their partners? Are they trying to satisfy themselves? And I would like to give a message to all of you that women are waking up and they just want to satisfy themselves, especially in America, in Europe. not as much in Asia. In America and Europe, we have started changing this. So the doctors that are doing these procedures, they have to focus on the woman. Is the woman satisfied? And you need to look at incidence of orgasms. Now, effects of the hormonal replacement therapy has had a lot of problems because of breast cancer, cardiovascular disease that have been reported since 2002, and Alzheimer's disease and stroke. Sexual functioning and obesity are also related because, of course, if somebody is very fat, their sexuality is decreased, but also the testosterone goes up, and the cortisol is going up. Now, physical exercise and sexuality has been measured since 1996. Dr. Meston asked 15 women to bicycle for 20 minutes, and she found the vaginal pulse amplitude, the measure of sexual arousal. However, what eventually they found that there is too much exercise, it's actually not good for you. So Dr. Hackney found like the inverse U shape, that sex drive is low with no exercise, but it's also low with very strenuous exercise. And what happens is because cortisol and testosterone have an inverse relationship. So when the cortisol goes up, the testosterone goes down. And as if you're overtraining, you're over-exercising, what happens is that your cortisol increases and the testosterone decreases, and you end up in the same square one that you were before you started exercise, when it increases the weight you increase, and your mood is not as good, and also your sexual drive declines. And of course, because of the lactic acid, you have the acidosis that is a problem after exercise. So you have basically a dilemma in old age after 45. You cannot exercise, you got a big problem because your cortisol is higher and your testosterone lower. You exercise too much because you have to do that to get rid of your visceral fat, and then you end up back in square one of no exercise. And there is a signaling technology that started with the pacemaker and Gerald Pollock from London University, and there is a number now of research, clinical researchers and histology researchers that basically look at diabetes, they look at visceral fat reduction, they look at significant changes in cortisol, and increase. I'm going to talk about the studies more. So Dr. Lambert, for example, tested 14 diabetics for neuropathy patients, and with signaling technology, and reported repair of the diabetic wound, increased mobility, and pain relief. In 2012, we did a study with 19 subjects, 3 treatments weekly for 4 weeks, and we found a significant increase of T3, DHEA, which also increases bone density, and it's a significant decrease of visceral fat, and also an increase of muscle mass. This is some of the studies that, this is the before and after of clinical studies. And Dr. Pollock looked at cortisol, and as you can see, there is no change in the cortisol, which is a very significant result with this type of technology. Increased toxicity actually is a very important component. So detoxification is a very, very important aspect of your treatments. It should be a very important aspect of your treatment, because the hormones and the toxicity, the toxicity will block the hormones, so it will affect your thyroid, it will affect all the entire endocrinological system, including sex hormones. Another study that we did with microscopic study, we found that for some reason that we don't understand, there is a blood separation, and the blood separation obviously helps the detox, but also helps to improve the immune system. This is some studies on lymphatic drainage, just one treatment. Dr. Bernard, 2013, looked primarily at sexual desire in women and how this technology can increase it, and increase self-confidence, feeling more attractive and basically less self-conscious. Dr. Pollock actually used this method for incontinence, and in 2006 he classified as a C class 2 specifically for incontinence. So and that's a very strenuous example. It's also FDA cleared. This is basically a more how it works. So they disrupted communications in cells, basically creating what aging and all the dysfunction and all the protein and hormones. And at certain energies below thermal noise, for some reason the electrons open up the ion channels in the cells and create signal amplification that can help in a number of functions. And it also helps in filling proteins, and the biosignals initiate the repair and regeneration that can be shown clinically on facial treatments, for example, by restoring signaling pathways. And what you see is you see a reduction of wrinkles, you're going to see a reduction of rosacea, of acne, of melasma, of pigmentations, and of course a lifting, and you see sort of a transformation that happens as a result of filling in protein signals and DNA signals and restating communications. And here is an example of herpes zoster with older adults, 86-year-old lady, and after 2 treatments, complete healing. Hair treatment, again, hair is another self-confidence. People will lose their self-confidence as a result of losing their hair. And a very important aspect of, again, we go back to women, that they want to satisfy their partners and they always want to appear pleasant. Temoshock in 2000, in the early 80s, started the research on the type C personalities, the people that are always very pleasant, they always like to satisfy everybody else, and that's the type C that gets melanoma and cancer. I did my research in London on emotion and physical illness, and I found that the emotion of shame has the highest correlation with physical illness. So the focus of psychotherapy, that is also very important for the aging process. Why? Because remember we said that resilience of psychological resilience can help cortisol and testosterone, your hormones. You can actually improve your physiological health through your psychological health. So the psychotherapy focus should increase on degrees of freedom, increased degrees of freedom, realistic approval of self and others, relief from shame, which is associated with physical illness, and grudges, and basically free yourself from the past and move on, and being introduced to yourself, understanding yourself, balance appraisal of who you are, and assertiveness without aggression, and learn how to turn adversity into advantage. And thank you very much.